We've always been curious about what we eat, but today, we have new tools to explore this age-old question. Artificial intelligence and robotics are changing how we understand our food. They're especially helpful in studying different ethnic groups and their diets. These groups often have unique food traditions passed down through generations. AI and robotics can track these dietary patterns and see how they're changing. This is important because our diets directly affect our health. By understanding these connections, we can make better choices for ourselves and our communities. We can also learn how to prevent diseases linked to diet. This isn't just about knowing what people eat, it's about understanding why they eat it. AI can analyze vast amounts of data to find patterns in our food choices. This helps uncover the complex interplay of culture, economics, and even environment on our plates. Ultimately, AI and robotics offer a powerful lens to examine our relationship with food. They hold the potential to revolutionize not just what we eat, but how we think about eating in an increasingly interconnected world. Understanding dietary changes starts with good data. Traditionally, researchers used surveys and interviews to gather information about food habits. While valuable, these methods can be time-consuming and prone to errors. This is where technology comes in. Wearable devices like smartwatches and fitness trackers can now monitor dietary intake in real time. These devices can track what we eat, when we eat, and even how much we move. This provides researchers with a more accurate and detailed picture of our eating habits. AI algorithms can then analyze this massive amount of data, identifying trends and patterns that would be impossible for humans to spot. For instance, AI can pinpoint how dietary habits differ between various ethnic groups, or how these habits change over time. Moreover, AI can combine this data with other information, like genetic data or environmental factors. This holistic approach allows for a more nuanced understanding of how our food choices interact with our genes and our surroundings. As the world becomes more interconnected, traditional diets are shifting. This is especially true in indigenous communities experiencing rapid cultural and economic changes. Let's look at a few examples.
Native American communities are facing a rise in obesity, diabetes, and heart disease. This is linked to a shift from traditional foods like wild game and foraged plants to processed foods high in sugar, salt, and unhealthy fats.
Black communities also experience high rates of diet-related diseases. Factors like limited access to fresh produce and historical socioeconomic disadvantages contribute to these health disparities.
South Asian communities are seeing an increase in diabetes and heart disease. This is often attributed to a shift away from traditional diets rich in fruits, vegetables, and lentils, towards diets higher in refined carbohydrates and unhealthy fats.
Chinese communities, as traditional diets rich in vegetables and seafood are replaced with more westernized diets, are also experiencing a rise in chronic diseases.
While often considered the baseline, white communities are not immune to these trends. Shifts towards processed foods and sedentary lifestyles are contributing to increased rates of chronic diseases across all demographics. Our genes play a crucial role in how our bodies process food, but what we eat can also influence how our genes work. This field of study is called epigenetics.
Think of our DNA as a recipe book. Our genes are the recipes themselves. Epigenetics is like the chef deciding which recipes to cook and how to cook them. Certain foods can act like switches, turning genes on or off. This can affect our health in both positive and negative ways. For example, a diet rich in fruits and vegetables can activate genes that protect against certain cancers. On the other hand, a diet high in processed foods can switch on genes that increase the risk of inflammation and chronic diseases.
Understanding these interactions is complex. However, AI and machine learning can analyze vast amounts of genetic and dietary data to uncover these intricate relationships. This knowledge can then be used to develop personalized nutrition plans tailored to an individual's genetic makeup. This personalized approach to nutrition represents a significant shift from the one-size-fits-all dietary advice of the past. It acknowledges that we are all unique, and our nutritional needs should reflect that.